Welcome to the new video MCQs on Parasitology Part 2. Question number 1. The infective stage of Toxoplasma gondii for humans in undercooked meat is tachyzoids, bradyzoids, oocyst, gametocytes. The right answer is option B, bradyzoids. Bradyzoids in tissue cyst survives cooking and infects humans. They establish chronic infection after entering the host tissues. Question number 2. The crescent-shaped parasite seen in blood films is Leishmania, Trypanosoma, Toxoplasma, Plasmodium falciparum. The right answer is option D, Plasmodium falciparum. Plasmodium falciparum gametocytes are banana or crescent-shaped. This feature helps to differentiate it from other malaria species. Question number 3. The parasite associated with vitamin B12 deficiency is Taenia saginata, Diphyllobothrium latum, Echinococcus, Hymenolipis nana. The right answer is option B, Diphyllobothrium latum. Diphyllobothrium latum absorbs vitamin B12 from the intestine. This leads to megaloblastic anemia. Question number 4. The string test enterotest is used to diagnose Ascaris, hookworm, Giardia lamblia, Entamoeba coli. The right answer is option C, Giardia lamblia. The string test retrieves duodenal contents for Giardia detection. This is useful when stool microscopy is negative. Question number 5. The parasite that causes snail fever is Schistosoma hematobium, Onchocerca, Taenia solium, Strongyloides. The right answer is option A, Schistosoma hematobium. Schistosomes require snails as intermediate host. Chronic infection leads to urinary and bladder pathology. Question number 6. Which parasite causes auto-infection through eggs in children? Taenia saginata, Fasciola hepatica, Ascaris lumbricoides, Enterobius vermicularis. The right answer is option D, Enterobius vermicularis. Pinworm eggs cause rapid reinfection. This can lead to persistent perianal itching. Question number 7. The liver fluke commonly acquired from water plants is Clonorchis sinensis, Fasciola hepatica, Paragonimus westermanni, Schistosoma japonicum. The right answer is option B, Fasciola hepatica. Humans ingest metacercariae on contaminated watercress. The larvae migrate to the liver and bile ducts. Question number 8. The most common cause of cerebral malaria is Plasmodium malariae, Plasmodium ovale, Plasmodium falciparum, Plasmodium vivax. The right answer is option C, Plasmodium falciparum. Falciparum infects red blood cells of all ages, leading to high parasitemia. This can cause severe neurologic complications. Question number 9. Romanas sign is characteristic of Chagas disease, African sleeping sickness, Leishmaniasis, filariasis. The right answer is option A, Chagas disease. It presents as unilateral eyelid swelling. It occurs after redovid bug transmission. Question number 10. The parasite that has operculated eggs is Taenia solium, Trichuris trichura, Diphyllobothrium latum, Ancylostoma duodenale. The right answer is option C, Diphyllobothrium latum. Diphyllobothrium latum eggs have a distinct operculum at one end. This feature helps in laboratory diagnosis. Question number 11. Blackwater fever is associated with infection by Plasmodium vivax, Plasmodium falciparum, Plasmodium malariae, Plasmodium ovale. The right answer is option B, Plasmodium falciparum. It refers to hemoglobin due to massive hemolysis. Falciparum malaria can trigger this severe complication. Question number 12. The infective stage of hookworm is egg, adult worm, rhabditiform larva, filariform larva. The right answer is option D, filariform larva. Filariform larvae penetrate the skin of barefoot individuals. The larvae migrate through the lungs before reaching the intestine. Question number 13. The vector for Bancroftian filariasis is Culex mosquito, sandfly, tsetse fly, black fly. The right answer is option A, Culex mosquito. Culex mosquitoes transmit Wuchereria bancrofti. Chronic infection leads to lymphatic obstruction. Question number 14. The cause of drinking water-borne cryptosporidiosis is cyst, trophozoite, oocyst, sporozoite. The right answer is option C, oocyst. Cryptosporidium oocyst resists chlorine and survives in water. They cause severe diarrhea in immunocompromised host. Question number 15. The parasite that causes visceral larva migrans is Toxocara canis, strongyloids, Ancylostoma brasiliens, Trichinella spiralis. The right answer is option A, Toxocara canis. Toxocara larvae migrate through human organs. Children gets infected from contaminated soil. Question number 16. The whipworm is scientifically known as Enterobius vermicularis, Trichuris trichura, Ascaris lumbricoides, Loa loa. The right answer is option B, Trichuris trichura. Trichuris has a thin whip-like anterior end. Heavy infection can cause rectal prolapse in children. Question number 17. The largest trematode infecting humans is Clonorchis sinensis, Paragonimus westermanni, Schistosoma mansoni, Fasciola hepatica. The right answer is option D, Fasciola hepatica. Fasciola hepatica is broad and leaf-shaped. It is the biggest fluke found in humans. Question number 18. The intermediate host of Taenia solium is pig, cow, sheep, snail. The right answer is option A, pig. Pigs harbor cysticercae that infects humans. Undercooked pork transmits the disease. Question number 19. Kala azar typically presents with microfilarial rash, hematuria, hepatosplenomegaly, muscle pain. The right answer is option C, hepatosplenomegaly. Leishmania donovani infects reticuloendothelial organs. This produces enlarged liver and spleen. Question number 20. The parasite that causes periorbital edema in early infection is Trichinella spiralis, Ascaris, Trichuris, strongyloids. The right answer is option A, Trichinella spiralis. Trichinella larvae invade muscle tissues. Edema around the eyes is a classic early sign. Question number 21. The intermediate host for Echinococcus granulosus is dog, sheep, pig, cow. The right answer is option B, sheep. Sheep ingest eggs and develop hydatid cyst. Humans are accidental intermediate host. Question number 22. The gold standard test for malaria is urine antigen, rapid test, peripheral smear, ELISA. The right answer is option C, peripheral smear. Thick and thin smears detect species and parasitemia. It remains the diagnostic standard worldwide. Question number 23. The motile corkscrew larva seen in stool in strongyloidiasis is egg, adult, rhabditiform larva, cyst. The right answer is option C, rhabditiform larva. Rhabditiform larvae appears in early infection. Autoinfection occurs when they transform into filariform larva. Question number 24. Infection by Paragonimus westermanni primarily affects heart, brain, kidney, lungs. The right answer is option D, lungs. The lung fluke causes chronic cough and hemoptysis. X may also appear in sputum. Question number 25. Loa is transmitted through the bite of black fly, deer fly, mosquito, sandfly. The right answer is option B, deer fly. Chrysops, that is deer flies, transmit loa. Adult worms migrate under the skin and conjunctiva. Thank you for watching the video. Subscribe to the channel to learn more MCQs on microbiology.